Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 3 most effective, powerful natural treatment for lumbar radiculopathy. Before I do that, I'm gonna go over the normal healing cycle for lumbar radiculopathy so it will make sense why this treatment is actually treating the root cause of the problem. It's extremely important to understand these 3 elements has to be done simultaneously in order to get a good result. You cannot pick and choose working on one of those elements and expect the problem will be resolved. So you have to utilize those 3 elements simultaneously. So lumbar radiculopathy, when we look at the normal healing cycle, I'm going to use external paper cut for visualization, but the same thing happened internally with the lumbar radiculopathy, but we don't see it because the skin cover it. So the first stage of healing is inflammation. You start to have swelling, redness, the blood start to rush to that area and experiencing pain, and usually this is the area where it occurs. Second stage of healing is a proliferation stage. So when you strain your muscle, when you have a tear, your body starts to build fibrotic tissue. And during that stage, you start to have several elements that occur at the same time, which fascia restrictions, muscle spasm, trigger point. Perfect scenario during actually the maturation stage, your body gets rid of everything from the proliferation stage and inflammation stage, and that will end the normal healing cycle, and that's mean it's resolved. If you have current symptoms now, that's mean you're not here. You're actually going back and forth between the inflammation stage and the proliferation stage. And in order to break that vicious cycle, we have simultaneously to work on both ends of that cycle, the inflammation and proliferation stage. So the first thing I work on is decreasing the inflammation. So if you have a mild inflammation in the back, and you have mild condition of lumbar radiculopathy, if you rest for like 2 to 3 weeks and your symptom resolve, that's indicative that it's a good sign that you have a minor inflammation and it's your body start to go through the normal healing cycle efficiently. But if nothing change or getting worse over time, that's a sign of chronic condition, that your body going back and forth between inflammation and proliferation, and rest is not gonna be effective to address it. So what I personally do for my patient, I use a very strong magnet, Magna Heal 2, and I have patient wear it in the back. They can wear it throughout the day or at the night. And this magnet is extremely very strong. The range is 3 to 4 inches that penetrate the body, that work on decreasing internal inflammation. At the same time, while I have them wearing the magnet to decrease localized inflammation, I put them on anti-inflammatory diet. There is a lot of food we eat, especially in the United States, that cause internal inflammation and slow down the healing cycle. So I put them on anti-inflammatory diet so the diet will not interfere with the current treatment. The fourth thing I had to do with those patients, doing nutrition analysis and figuring out what kind of vitamins, mineral that actually slowing down the healing cycle. Why? Because, for example, you need magnesium, you need D, you need zinc, you need C, you need B for your body to transition from inflammation stage to proliferation stage to maturation stage. And if you have vitamins and mineral deficiency, your body gonna be stuck in between inflammation and proliferation stage because you don't have that ingredient that the body needed for normal transition to maturation stage. So at the same time, while I'm working on the inflammation, I have to work on the proliferation stage with my patient. So the first thing to do in the proliferation stage is breaking the fibrotic tissue, the scar tissue. When you look at this image, the first one here, that's normal muscles. When you have a muscle tear or strain, it's look like this. When we start to have fibrotic tissue, it look like this very random tissue that look very not pleasant looking here. And when you have fibrotic tissue, that tissue starts to compress on the nerve and cause the radiculopathy pain. That's happened also from osteoarthritis. When you have osteoarthritis, fibrotic tissue could compress here. Why this could be an issue? Because our muscle should act like a rubber band when it contracts and relaxes, stretch like this. So when you have fibrotic tissue, it's like you have a knot in a rubber band. So when your muscle contract will not stretch much, and you will notice with those patients that you actually have a lot of muscle spasm, especially in the back here, in the glute area, piriformis muscles area. That's because there's a lot of fibrotic tissue, and actually you can test it at home. When you start to palpate in the buttock area or the back area, you feel like a nodes or like a kind of rocks or sand feeling in the tissue that doesn't feel like a soft meat. That's what's supposed to feel like if you don't have fibrotic tissue. So what I personally do to decrease fibrotic tissue, I actually use the A3 to break the fibrotic tissue, the superficial fibrotic tissue, and I use the A5 to go deep in the glute area and around the buttock area to break down the fibrotic tissue. We have to break all the layers of fibrotic tissue so it will decrease the compression on the nerve, so to decrease the symptoms. At the same time, we have to work on the fascia system for the fascia restrictions. So what is fascia? So next time when you go by meat, look at the white filament. That white filament is the fascia layers, and we can see it here in the cadaver. The white filament here, that's a fascia layer. So to make things complicated, we have several fascia layers, but don't worry, the treatment very simple. So we have two major categories of fascia: superficial fascia and deep fascia. The deep fascia is actually divided to 4 subcategories of fascia layers. So the superficial fascia wrapping the entire body. It's like a Spider-Man suit. The apparatic fascia wrapping a group of muscle fibers. Then we have the epimysin wrapping each individual muscle fiber, and premiysin, a bundle of muscle fibers. And at the end, you have each individual muscle fiber wrapped with the fascia layer. To make things more complicated, but don't worry, the treatment is very simple. Each of these layers is actually divided to 2 to 3 layers, and as you can see it in this image, so apparatic fascia is 2 to 3 layers on the top of each other. And when we do the treatment, we cannot pick and choose. I'm going to work only on a superficial layer and ignore the epimysin, premiysin, and endomysin, because the problem when you have fibrotic tissue, it actually glued all these layers together and cause restrictions in several layers simultaneously. That's why the treatment I mentioned to you, you have to address inflammation, fibrotic tissue, and fascial restriction simultaneously, because the problem is so complex, affecting different systems, that has to be addressed from all angles. Otherwise, you're actually doing half job. So what I personally do for releasing fascial restrictions, I use the A1 to release apparatic and superficial fascial layer in the back. And also I use the A5 that goes deep, like up to 2 inches deep in the tissue, to release the epimysin, premiysin, and endomysin. If you have any comment or question, leave it in the comment section and I will answer it in the future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.